Well, to a stranger, Pam Ellis still radiates, but behind closed doors, this Charlotte grandmother, she's exhausted. She spends most of the day sleeping, has lost a third of her body weight, and has gone through 4 infusions to treat MALT lymphoma. To add insult to injury, she's faced severe and unnecessary stress to the errors from Medicare and Social Security.
We're the kind of people that always pay our bills. You know, you think you do everything right, and then all of a sudden, Pam doesn't have insurance when she needs it most in her life. You're right, I am.
Wow. Well, despite a stage 4 cancer diagnosis, the federal government ended this Charlotte woman's medical coverage before she could even start treatment. And with medical bills mounting, her husband asked WCNC Charlotte for help. Thank you for joining us. I'm Nick Sturdivant. I'm joined by Nate Morabito. Wow, that's such a powerful story. Nate, let's start from the beginning. How did you get in contact with his family? Just walk us through the beginning of this story.
Yeah, so much to unpack. It's so heavy. So Dana Ellis, that's Pam's husband of 45 years. He emailed me a little more than a month ago. And I remember getting the email immediately and seeing the situation and saying, we have got to do something to help this family. Because this woman, as she was discovering she had cancer, received a bill in the mail from Medicare. She's on Medicare. She's 67 years old. That's what she relies on for her medical coverage. She receives a bill from Medicare for more than $3,000. And she says, this doesn't seem right. This is unusually high. And her husband says, yeah, this is not a normal bill from them. We're going to start fighting this bill. We're not going to pay it. We need to dispute this and appeal this. So he starts going through this process and spends months working to dispute the bill with Medicare and also with Social Security Administration that's kind of helping administer the Medicare coverage. And he thought his efforts were still in progress. He thought there was no formal decision yet. He had received, he says, nothing in the mail notifying him that we are not going to stop this situation. We're going to keep reviewing it. That's what he thought. Turns out Social Security Administration terminated her health insurance and did so retroactively without them knowing. And you can imagine, even if you just had regular health issues, the impact that would have. Now try to put yourself in this woman's shoes, stage 4 cancer, no health decisions. Now you have to make decisions, no health insurance. Now you have to make decisions based on the worry of financial issues.
I want to ask you a 2-part question. What was your reaction when you heard this story, and what was their reaction?
So first of all, I was outraged. I said, this is ridiculous. You know, there should be some kind of coverage gap so that if you are fighting a life-threatening illness, that you don't lose your coverage. Not to mention, this was no fault of their own. We later found out, right? They are not at fault here whatsoever. We didn't know that at first, but I was outraged by it. I thought, absolutely, we should be able to help them. Their initial reaction was shock and depression, quite honestly. She said that's the low point for her. Not when she was diagnosed with cancer, but when Social Security Administration terminated her health insurance coverage. They reached out to their congressman's office, Jeff Jackson, Representative Jeff Jackson, and started working behind the scenes with them to try to get this resolved. But that moved much slower than they hoped. And they were really at the point where they didn't know where else to turn, and so they turned to us.
And before we get to Jeff Jackson, I want to hear from Pam and Dana and their reaction.
How did that feel when that letter came in that she hasn't had insurance for 3 months?
Oh my God, it was right when we were ramping up for everything, and it was a total shock to us.
And you talk about Representative Jackson. I mean, what happens next after this?
So, you know, his team starts working behind the scenes to try and get some communication going. And again, it's going on too long. I mean, they're having to make decisions about her treatment based on whether or not she has insurance. I mean, think about the medical bills, roughly $100,000 is what he told me.
Wow.
And of course, he's going to pay whatever it takes to take care of his wife. And imagine the weight on her shoulders now, thinking about having to burden her family with a financial cost as she tries to fight this disease. So they reached out to us and said, what can you guys do to try and help? And I told you, instantly I said, this is a priority for me. And I immediately started communicating with Dana, the husband, and got some specific details and reached out to Social Security Administration and to Congressman Jackson's office and said, where does this thing stand? What are you all doing to try and get this resolved? And particularly to the federal government, why aren't you fixing this quicker than you are?
Yeah.
And it's unbelievable. Within a couple hours, he received a phone call. He'd been fighting this for so long. He quickly receives a phone call and says, we're going to fix this. We're going to try to make sure we kind of remedy this situation. This is a man that went to the Social Security Administration office here in Charlotte, who called Social Security and Medicare multiple times, saying that he was essentially dismissed. At one point, he was removed by security from the office.
Are you
there.
serious?
Yeah, I mean,
wow.
What are you going to do? Your wife is facing the most difficult battle of her life. She has no insurance. You're getting nowhere with bureaucracy. And, you know, of course you're going to get mad. Of course you're going to get angry. And I felt like he didn't think people were listening and taking it as seriously as they could have. And he told me at one point, it's like he was disputing a dental bill or something like that. Yeah, I mean, this is life and death situation.
And we actually got a chance to hear from Representative Jackson. Here's what he had to say.
I think the core issue that this has exposed is that we really shouldn't put people in a situation where their coverage can be denied while they are disputing a claim, particularly in cases like Mrs. Ellis, who had stage 4 cancer. There could be life-threatening consequences to that as a policy matter, that we would allow that to occur, that we would allow coverage to be denied under those circumstances. It seems to me to be really inappropriate and something we should address at a policy level.
Here, there, he talks about the Social Security policy. Isn't the agency supposed to give folks a heads up?
They're supposed to. That's what their policy says that I read.
Yeah.
I mean, and they're supposed to give them a long enough runway so that they can understand what's about to be coming around the corner, and really to reduce any unnecessary anxiety. And the Ellis family tells me that they received nothing, no heads up whatsoever. Again, he thought his appeal was still in process. He was still waiting for some kind of final decision on that. And kind of out of the blue, they're told, nope, not only is your insurance gone, we stopped it 3 months ago. So imagine all of these medical bills that have been essentially denied by Medicare because for months they thought they had insurance. They didn't.
So what happens next?
So what happens next is they quickly get her back onto the insurance after we get involved. All right, she's back on the insurance, number one. Most important thing, right? In the meantime, they still have more than $3,000 bill that they've been disputing. And so over time, we continue to push, you know, what's going on here. Finally, fairly recently, after more than a month of investigation, Medicare and Social Security got on the same page. That $3,000 bill was a mistake. It was a processing error. Should have never been charged to begin with. That's been removed from their account. She has insurance. And on a bigger, broader picture, now the question is, who else is vulnerable to this? If there is not a process in place to protect someone while they're fighting a bill or while they're facing a life-threatening illness, should there be one? And that's what Congressman Jackson's office believes. And he told us that he believes it's happening in other congressional offices too. That's
the scary part. And this seems like a small error, a processing error that you shouldn't have to come to us. I'm glad they did come to you, and you shouldn't have to go to Congress. But I'm sure that's what people are thinking when they hear this story.
Right, it should never have to get to this point. And that's kind of like our point too. We are happy to help. Right? If you've got a problem, we have a track record of helping people, including in this case. If you have a problem with a federal agency, your member of Congress has an office, a constituent office, that is there to help you. If you have a problem with a state agency, your state lawmaker has a constituent services office to help. But we really don't think it should even get to that point. We're all more than willing to help out, and we help people daily on this kind of thing. But why not fix the system so people like Pam don't fall through the cracks? And thank goodness it got resolved when it did, because she delayed her treatment by several weeks. And you know, she is just holding on here. She is fighting this thing, and she wants to be around for a while to come. And now she can do that without having to worry about the cost that it's going to put on her family.
I was just about to ask you, how is she doing now?
She's recharged. She had her, it's ups and downs for her, but she had her daughters and her grandchildren in town recently to celebrate her 67th birthday. Wow. She turned 67 in April. And now that she has her insurance back, now that this other bill is taken care of, she had a wonderful visit with her family. She is making plans, and she says that's a good thing that she's making plans, because I don't even think she realized that she was starting to make plans. I feel like that light that was dimming, her husband told us, is kind of starting to maybe flicker again, and maybe more than flicker.
That's amazing right there, yeah.
But, right, this is a long fight,
yeah.
And the fight was made longer and harder because of the government.
And we have Pam's reaction to this. Listen to her.
I see those 2 little grandkids. Yeah. I just want to be there a few more years if I can. I want to see them get older. I want to do our vacation this summer and see my daughter get married in August. I'm sorry, I have to keep positive.
I mean, you just feel so terrible for her. She's a grandmother. You say her husband, Dana, sees the light come back in her eyes. You mentioned it earlier. There are probably hundreds, maybe thousands of people in this situation. If they're in this similar situation for the folks at home, what can they do?
All right, so number one, Social Security Administration and Medicare, they're on notice now, right? We have told them this is a problem, and we've helped fix the problem, and we're putting story on the news and on the web about the situation. So there already is a higher standard, number one. And Social Security tells us if you have any issue with kind of a benefit termination or a dispute, you need to reach out to them. They will be available to help respond. And they feel bad about this case. They apologize. They know it took too long. They know they weren't responsive enough. And same with Medicare too. And I'll also mention this. Many agencies have what's called an ombudsman. Mm-hmm. It's essentially like a mediator, someone who will listen to a consumer's concerns and help try to find some middle ground and help resolve it. That is something else Medicare says people can do. If you have a bad experience or you need help with a complaint, you can file that with them. They will listen. They will try to help you. And again, so will we.
Nate, doing the work for the people, man. Thank you.
That's what we're here for, right?
Yeah.
That's why we get in the business, is to make an impact and to help people and maybe lighten the load a little bit. This is a heavy load, but hopefully it's a little bit lighter now because they reach out to us.
Well, a reminder, WCNC Charlotte is committed to reporting on the many issues facing the community we serve. We are always seeking solutions for you, so make sure to send in your tips or questions to newstips@wcnc.com.